Hello and welcome to another episode of PodcastDX, the show that brings you interviews with people just like you whose lives were forever changed by a medical diagnosis. I'm Lita.
I'm Ron.
And I'm still feverish.
Yes, she's still feverish. Collectively, we're the hosts of PodcastDX. On today's show, we're talking with Eva, one of the co-founders of Wellacopia. It's a company that helps patients find the right medical care provider. Hi, Eva.
Hi, Eva. How are you? Thanks for joining us today.
Thank you so much. I'm doing well. Not, I guess, a little better than you guys are doing today.
Yeah. We're the poster child for the flu this year.
Yeah, definitely get your flu shots because it makes all the difference. Hi, Eva. Can you tell us what exactly is Wellacopia or Wellacopia? Yeah, Wellacopia. And how do you pronounce it?
Wellacopia is a platform that matches healthcare relationships. So it really mimics a dating site like Match.com or OkCupid.
Okay.
But it's to help you find your ideal medical or wellness providers. So it's all about relationships.
That's fantastic. That's absolutely fantastic. I know when I've had to pick a new physician, I've actually requested that I come in for an appointment just to talk with them. And often that surprises physicians that you actually want to have someone that you can, that you match well with and that you sync up with. So thank you for starting this program.
I've got a question, Eva. What actually inspired you to start Wellacopia? Something's telling me that you ran into an issue with a provider.
So Wellacopia began for an accumulation of a lot of experiences I had. So I've been on the professional side of healthcare for the last decade, working in pretty much every area of healthcare you can, like clinical research, laboratory research, working in clinics, working in hospitals. I also have a degree in neuropsychology, a degree in nutrition science. And then I was gung-ho about being pre-med, decided not to be a doctor after I graduated from college. I ended up marrying a doctor, which is really just a coincidence, but I've gotten to go on that journey with him at the same time. So all of that, and then the 20 years I spent as a patient, as someone with a chronic illness, and half of that time, 10 of those years, I went undiagnosed.
Okay.
So I have fibromyalgia and hypermobility syndrome, possibly some other things, but, jury's still out on that, so don't know. But sure. I would say I am generally well managed at this point, and it took a very, very long time to get to where I am. And going back to Wellacopia, over 3 years ago, when I came up with this idea, I was thinking, what is my greatest pain point? And of course, it's my pain, but aside from the pain itself, what didn't exist for me that I really wish did? And I thought that finding the right diagnosis and finding the right care team was just way harder than it should have been.
Mm-hmm.
And at the same time, I was using OkCupid, the dating site, which is how I found my husband.
Oh.
Not really related to having found a successful relationship on OkCupid, but I really loved the dating site model of trying to go through all of the wonderful people in New York City, wonderful and not so wonderful, and just kind of cutting to the chase of someone who is at least on the surface a better fit for you than someone else you may meet randomly. And I just really like that approach. On OkCupid, and I assume Match.com also, you're asked a lot of questions based on what you're looking for and also how you identify. Mm-hmm. And I thought that finding a partner for life is way harder than finding the right doctor. So why can't we find a doctor more easily that is right for us in a similar way?
Mm-hmm.
That's where the idea came from, and I basically put together the concept of ZocDoc, which is something that exists in New York City as well as a number of other cities around the country, and then the concept of OkCupid, and boom, Wellacopia was born.
Okay.
That's awesome. It makes a lot of sense.
Yeah.
Yeah.
Well, Eva, as a patient with chronic health concerns, I am very aware of the limited face time that you get with the doctor nowadays. We were just actually talking to another guest previously that, you're in and out in like 30 seconds and they don't really get a chance to find out more about you. That wasn't always the case. I know I'm older. I'm going to date myself here. But when my kids were little, we actually had a doctor that would come to the house. We actually had house calls by the doctors, and those doctors gave you all the time that you needed, but times are different now, right? So what has changed in the typical relationship between a patient and a healthcare provider? Why is it so hard to find the right healthcare provider?
So actually, what I see as the big difference is the words that you touched on, relationship. The perspective of the relationship has completely shifted. When someone used to be a partner in your care, someone that knew who you were, knew who your family was, and saw you as a person, that they even came to visit at your house, versus now it's very much a transactional relationship. And I compare it to a car and a mechanic situation. At the same time, I like to point it out, and this is a huge part of my work, both professionally and personally, is that I don't see it as a one-way street, like one side is at fault, or even that any side is at fault, but rather that it's an issue from the doctor's perspective as well as the patient's perspective. I really see it as a war. And for that reason, the little time that we have with our doctors, which is really controlled by, we get financial and legal constraints.
Mm-hmm.
There is a way to use that time differently. I wish it was longer, but I think it's not so much a matter of time, but how that time is used.
Okay. And let's say that you've got 4 minutes FaceTime with the new doctor. Do you think that having some type of a computer program or something that would kind of go through your symptoms ahead of time so the doctor can kind of scan through and make it easier to make a diagnosis? Do you think something, like technology, do you think technology will be helping?
I definitely think technology will have a positive influence in giving doctors as well as us the information we need faster. And Wellacopia helps with that. But I think more importantly, it's what kind of information is fed to us faster.
Okay.
So I think a lot of the information that doctors get, if they get any, isn't necessarily the most important information. Sure, it's essential that they know things about our medical history, but we're much more than our medical histories and like list of medications and so on. We are also people that have lives, and those lives influence our health, whether it be physically or mentally, emotionally. That is something that led to my lack of diagnosis for a decade. So part of me building Wellacopia and also being an advocate, as it has been for relationships, isn't just about how can we use technology better, but more importantly, how can we build relationships in a very short period of time?
Right. And that's the key word, relationships, because the more time you spend with the doctor, the more they're going to be able to get to know you. I realize this is a bit antiquated, but I was reading a study from the National Institute of Health back in 1999. I have to add that. But it talked about how different countries consider the optimal visit length for patients and physicians to range in the Great Britain anywhere between 5 and 8 minutes and 10 to 20 minutes or more in the U.S. In Sweden, for example, with an additional 6 minutes more for specialists. The study showed that physicians that increased their average office visit length by only a couple of minutes wound up asking more questions that were related to the health history and the psychosocial concerns of the patient. Do you still find that to be the case, or what's your thought?
Yeah, absolutely. So first of all, when it comes to time allotted for a patient-doctor relationship, it really does change based on what specialty the doctor is or lack thereof. It's actually something I've been asking a number of doctors in my area about, like how much time do you spend? But regardless, the psychosocial approach is, in my opinion, absolutely necessary. Really getting a whole picture of someone's life, but through like how they think and how they feel.
Right.
And their support networks and.
Yep. It's like I said, we are more than what's on our chart.
Oh, absolutely.
And that's something that doctors fail to recognize. But again, I want to preface that I don't think it's the doctor's fault, and I can go into that further if you want. But,
yes, definitely.
It's So
I was going to ask you. So, what have you found as you've gotten more deeply involved in this?
Well, having worked on the practitioner side, whether that be as a nutritionist or working in clinics with doctors, and now being married to a doctor, I really can't stress enough how much of an influence that's had on my understanding. Just to give you a bit of context, my husband is a fellow in a specialty, which means that I went through residency with him as well, which goes before fellowship. And he's very much, as I say, quote unquote, in the system. So he doesn't have autonomy. He's very strict of time and has more constraints than anyone who has their own clinic. So from his experience, I have learned just how much pressure he's under and how many legal time and financial constraints he has, despite being an incredibly caring human being. Sure. And then also in medical school, this sounds bad, but they're like kind of brainwashed, right? They have so much medical knowledge to retain. In fact, it's an ever-growing encyclopedia of medical knowledge. And they're taught to just, again, this doesn't sound great, but kind of be robots. Mm-hmm. They're like, okay, I need this means this, and if I don't know the answer, then I have to do this, or maybe I have to give the answer even when I'm not sure of an answer. And the terminology they use, the dialogue they use with their patient is very to the book.
Yeah, and you know what? I just want to interrupt real quick to say that's exactly why we have our podcast, because rather than getting doctor speak, we're actually talking to patients or people who've gone through experiences, and they can relate to others in normal, everyday, conversation.
Right, and they might look at things from a slightly different perspective as well.
Yeah, but I also find it that for that reason, it's very important to speak of the doctor's perspective. Because
Sure.
I mean, it's constant. Us as patients, we're overlooked, underserved, unheard, and we're angry with doctors. We're angry at them for not giving us what they need, not having answers like I did for a decade, right? And it's easy for us to get angry, but it's not that the doctors are bad people. They were unfortunately taught that this is the way that they should provide the best care possible, and they're just not given enough room or really enough education to do it otherwise. So on Wellacopia, for instance, our practitioners, whether they're medical or wellness practitioners, the main requirement for them to be on Wellacopia is that they see everyone as a whole person. They don't see them by, the issue that they have or the organ that is malfunctioning. It's about them as a whole human being. And a lot of our practitioners are people who have already been in the standard medical system and have seen that it doesn't work, that approach doesn't work. And there's more to a person than what's on their chart. So it often takes a while for a practitioner to realize that system is broken. So I really urge patients to be conscious of the fact that doctors are people also.
Sure, right.
And they're trying their best. And to their knowledge, and unless they start to think outside the box, what they've been taught is best because that's what everyone else does. That's what they do in medical school. And they're like, well, this is basically the written law or even unspoken law of what one should do as a doctor, and therefore I'm going to do it until I really see that this isn't working.
Mm-hmm.
Eva, earlier you mentioned that you yourself have some chronic conditions that you're dealing with. What were your experiences as you worked through the healthcare system?
Well, I first started seeing specialists when I was 12, after probably being seen for a year or two. And, the main reason that I think I went undiagnosed for so long is that as a teenage girl, someone who is having vague pains, right? Fibromyalgia is like you have almost every kind of pain you could get, like throbbing and sharp pain and burning and all these different things. And it's just sort of randomly around my body. So I'm a teenage girl who can't really explain what's going on. And at the same time, I will fully admit that I was a bit of a drama queen. But despite being a drama queen, I was all about being a strong person, an able person. So I couldn't believe that my loving parents, who I'm close with, didn't understand that I was telling the truth.
Mm-hmm.
I'm in pain. I have no interest in being weak, despite drama or not. And doctors saw it the same way. They're like, well, we've tested you for lupus and MS and RA and Lyme. I don't know, a lot of other tests that could have picked up what I had, maybe, and multiple times as well. So everyone just thought it was in my head, which I know is not a foreign concept to people listening to this podcast.
Right.
Mm-hmm.
Right.
Absolutely. Did you ever get to a point, I don't know if you would at age 12.
Well, her parents could have.
Well, absolutely. But like getting a patient advocate, somebody who's going to work on your behalf. Well, yeah, you're right, Lita. Probably would have been her parents at that age. But as you got older, a patient advocate who's going to really push on your behalf to find out what's going on with you and for you to get the care that you need.
Yeah, I did not have an advocate. I really wish I had. I had to become my own advocate, right? Like I definitely at times thought that I was crazy because everyone's telling me I don't have a diagnosis. I thought, okay, maybe I am just making this up. But then I would have the experience of my pain again and recognize that what I was going through was not normal. And so I would advocate for myself.
Mm-hmm.
In fact, I'll tell you the day I was diagnosed with fibromyalgia, which was one of the experiences that led to what I've built today, is I saw a neurologist in New York City. It was a shot in the dark experience after 10 years of searching. And he was the first doctor to ever ask me intentionally about my life outside of my chart, my medical history. He asked me, I'm going to be, very candid here. He asked me, did I have any childhood trauma?
Mm-hmm.
And he asked me this out of the blue. Like I didn't know where he was going with this. And I said to him, no, I actually had a wonderful childhood. I feel very lucky. And then he kept prying. He said, really, is there anything that could have stressed you out on a regular basis growing up? And what I didn't realize was, at the time, this was 2010, it was believed in, and honestly, I still feel this way, that people with fibromyalgia, the greatest common denominator is trauma. Mm-hmm. Now, trauma comes in all shapes and sizes, right? Mm-hmm. So this doctor asked me about trauma, and I'm like, no, definitely not. Great childhood. None of the standard things that I won't list here. But when he said, did you have chronic stress going up? I realized that as a pre-professionally trained ballet dancer for 15 years, yes, I was mentally, emotionally, and physically traumatized for my entire childhood.
Right.
But I loved it. It was like a love-hate relationship. I equate ballet to an abusive romantic relationship, especially the school I went to. But I never would have mentioned that to him if he didn't keep asking. He knew that there was a missing puzzle piece that wasn't obvious.
Mm-hmm.
And so in many ways, he was an advocate for my experience because he knew I had gone through such a long haul of, no answers.
Right. So he just wanted to
was
keep
like,
digging.
"There's
He
more."
wanted to kind of dig as deep as he could right at the beginning and get as much. Yes, I understand that.
It didn't take much time either. We were only together like 10 minutes, maybe less.
Wow.
Yeah.
You searched for 10 years and you found out in 10 minutes.
Right. Well, that's, I think, why the whole reason for your company is that you need to find that physician, that healthcare provider that clicks, that can ask the right questions and listen, and oh, that's amazing. Yeah, that's wonderful. And we have known a few ballerinas, and just the trauma that your feet alone have gone through, the blood and everything. Blood, sweat, and tears. I feel for you.
Yep.
Well,
For sure.
where do you see Wellacopia going in, say, like 5-10 years from now?
So for Wellacopia, there are a lot of, in some ways, comparable options to find healthcare right now, which is great.
Mm-hmm.
Some are better than others.
Mm-hmm.
But where we differ is in our focus on relationships, as well as people with chronic illnesses like ours. And in 5 to 10 years from now, I hope to expand on our mission, where we aim to be the place where people go to find comfort and find relief from pain, both emotionally and physically, because Wellacopia is where you can find trusted care and resources.
Okay.
So that's what I think of when I see Wellacopia's future from an intangible standpoint.
Mm-hmm.
You go there because you want to feel that comfort, that relief, and something is there for you. Also, in 5 to 10 years, actually sooner if possible, I really see us working together with other brands rather than competing. I'm very anti-competition, and I don't understand why people are doing all similar things
Mm-hmm.
separately. So I would say a big goal of ours is to find a way for all of us to work together rather than trying to accomplish the same goals independently.
Mm-hmm.
Eva, I've heard you also host a podcast. Is that complimentary to your organization?
Indeed, it is. Although wasn't intentional. Another podcast, Invisible Not Broken.
Oh, yeah.
Hosted by Monica Michelle.
Yep.
I came on her podcast 2 or 3 times. Monica has Ehlers-Danlos syndrome as well as other host of issues, and we got along really well. So she actually asked me to be a co-host last January 2019, and we have been ever since. And it's been an incredible experience. I just ended up doing it with her because, I enjoyed talking to Monica, and I love talking to people. I love candid conversations. So that has grown into a wonderful asset for Wellacopia, since I think almost half of our users have come from listening to the podcast. But it wasn't necessarily supposed to be a Wellacopia extension. And there are some big things coming with the expansion of our podcast, but I will leave it there.
Okay.
To be continued.
Okay.
All right.
Well, we are looking forward to,
Yeah, we'll be following that.
Absolutely.
I have a feeling that Wellacopia is a technological advocate for people. So instead of a person that goes through training and becomes an advocate for patients, Wellacopia is the advocate, because Wellacopia is working for the patient as well as for the physician or the healer. But specifically, I'm looking at it from the patient standpoint. So do you consider Wellacopia to be an advocate of sorts?
Yes, it's funny. I've actually never thought of it that way, but absolutely. It provides us with choice. And this is a business term, and it's not a great one, but we're healthcare consumers.
Mm-hmm.
It allows us to have access to people and experiences who are right for us, not just based on location and whether or not they're in our insurance or or something very basic that way.
Right.
Wellacopia matches with you with a person, gives you that choice so that you can find and have exactly what you are looking for, mirrored by who that practitioner, or how that practitioner represents themselves.
Well, Eva, what's next for you, and what's coming up for you? What new and exciting things?
Well, speaking of advocacy, I would say next is advocacy for this movement.
Okay.
Through the TED Talk that I did, that will be out soon, through Wellacopia, through the podcast, for both sides, patients and doctors, to work towards fixing our healthcare system and fixing it through humanizing the relationships that make up that healthcare system.
That's great.
And this is true in America and outside.
Sure.
Yeah, and may I suggest that you move that into the VA system?
Yes.
Okay.
Yes.
Yes. Yeah, unfortunately, yeah, that's a whole nother
Well
topic.
needed,
Yes. Eva, what tips, hints, and helpful advice do you have for our listeners? And how can we learn more about you and your podcast and Wellacopia?
So my tips would be, I'll actually give a tip for patients and I will give a tip for doctors. Hopefully
Awesome.
some are listening.
Yeah.
So for patients, yes, be an advocate for yourself. That's just another person.
Mm-hmm.
That doctor is another person with a stethoscope, and you shouldn't be intimidated. It's a person who wants to hear you, wants to understand, and be your partner. So let them be your partner. And you can do that by looking at them as a person rather than someone you're at war with.
Mm-hmm.
And also speak up for what you find to be important, even if it seems medically irrelevant. So in my instance, I was a ballet dancer suffering both emotionally and physically, but I never thought it was relevant to tell my doctors because I had no idea it could be linked.
Mm-hmm.
And even if it wasn't linked, it was important for my doctor to know that that was something I was experiencing in my life.
Mm-hmm.
And then for doctors, I would mirror that by saying that one should be curious. Always be curious. Ask more and listen more, because we may not tell you as patients what's going on unless you ask.
True. Very
Yeah.
true. And your website is Wellacopia.
Wellacopia.com,
Okay.
Wellacopia. Yes, I made up that word. And Invisible Not Broken is invisiblenotbroken.com. And we're also on every place one would find podcasts, iTunes, Spotify, stuff like that. And yes, I kind of alluded to this, but I did a TED Talk last Friday.
Right.
It's now February 15th, but it has not aired on YouTube yet, but maybe by the time this podcast airs, it will have. And the title of the podcast is the title of the TED Talk is 5 Minutes to Fix Our Broken Healthcare System.
Oh,
nice.
Good.
Catch.
Yeah. So if you Google 5 minutes to fix our broken healthcare system, it should come up.
Okay.
Great.
And we'll make sure we put links on our website and social media.
Yep.
Yep.
I'm writing that down right here.
Okay. Good deal. And thank you again for coming and speaking with us. And I think this is a vital tool for everyone.
Absolutely.
Because nowadays you do just kind of look through a listing of names in a book.
You don't know what you're getting.
And you don't know who would be the best fit for you. So this is a really vital part of our healthcare system that needs to be out there. And thank you for providing it and for taking the time to speak with us about it today.
And thank you guys for letting me share the message.
You're welcome. If our listeners have any questions or comments related to today's show, they can contact us at podcastdx@yahoo.com, through our website, podcastdx.com, on Facebook, Twitter, Pinterest, or Instagram.
And if you have a moment to spare, please give us a review wherever you get your podcast. As always, please keep in mind that this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment, and always seek the advice of your physician or other qualified healthcare provider with any questions you may have regarding a medical condition or treatment and before undertaking a new healthcare regime, and never disregard professional medical advice or delay in seeking because of something you have heard on this podcast.
Till next week.